Thank you for joining this Lunch and Learn. We're going to be talking about palliative end-of-life care for people with learning disabilities. So today we're going to have a talk from People First Merseyside, and then Carl Jones, who is clinical lead with Knowsley Community Learning Disability Team, will be joining us to present on the Merseycare Advanced Care Plan Easy Read document that they've developed. We'll be talking about some resources that are available to support health professionals in practice. Some of these have been developed by People First, and then some of these were developed by the Victorian Stewart Project, which you might have heard of, developed at Kingston University, co-developed with people with learning disabilities and named after two people who inspired the project. And then finally, we'll have some time for questions and conversations with our speakers. So I'd like to introduce People First Merseyside. People First is run by and for people with learning disabilities. Their mission is to ensure the voices of people with learning disabilities are heard and valued. And today we're welcoming Paul, Nicola and Rebecca, who are going to be supported by Maddie, who's their project worker, and they're going to talk about who People First are, how the David Project came about, and what key takeaway messages they'd like people to leave here with today. So I don't know if Maddie's been successful in getting Rebecca. I think she's gone out of the room. So I think we'll perhaps start with Paul and Nicola. Are you ready to talk with us?
Hello, I'm
Hello.
Paul.
Hiya, Paul.
Hello. Pleased to meet you all. Can I tell you what my role is here?
Absolutely, that would be a great start. Thanks, Paul.
Well, I'm the host of People First. We welcome visitors to the office, make them cups of tea and coffee, and show them about. You might get lost. You might say, "Where's the kitchen?" I could show them where the kitchen is and the toilets. So that's what I do, the host.
That's lovely. Great. And Nicola?
I am Nicola. I'm the secretary of the group.
Fantastic. It's nice to meet you both. I'm really glad you're here. So I've got your slides up on the screen. Are you able to see those?
Yeah.
Yeah. Do you want me to start moving along?
I'm the first one. Then if you want. People First is a South African organised. We have been running for 7 years. We are member-led. This means we are run by autism people and learning disabilities, or autism people and learning disabilities. Next slide. We run our own office in Merseyside. We speak up about important issues that affect the lives of people with a learning disability. 10 members are on a board of the directors. They make decisions for the company. Next slide, please. Members during local meetings like the LD and autism subgroup at the Royal Hospital. We are members of the Chester and Merseyside Chancellor in the meeting. We train over through David and red flags for cancer. We organise trips and events like our hate crime comedy event at the Royal Court. Next slide.
David stands for Dignity and Voices in Dying. The David Project began in 2019 after the death of our friend David Morley. David did not make any end-of-life plans. This made us realise how people with learning disabilities are left out of conversations about death and dying. We want to make sure that people with learning disabilities have the information and support they need to make the end-of-life choices. We also want to ensure that people with learning disabilities get support after a death. Thank you.
I'm going to take over that. Hello, all right. The David Project made films on will writing, funeral planning, organ donation, bereavement, and vacancy costs to go with our film. We also made easy read booklets that can support people to learn how these topics through easy read information and games. We had worked with photo symbols to create a model for death and dying, images to support with our booklets, and they are now available on the photo symbols database. We have also worked with many of the military hospitals, including the Royal, where we set up a budget to talk about the cancer. We are looking forward to training to become volunteers with a cancer support group. We are also in the process of creating an available road path with Liverpool John Moores. We are very expert to make sure that we're writing as accessible as whatever. All our booklets, David Project booklets and films are now available. Anyone can get these for free on the website. We can pull off black these hats. Yes, we can say this is where you can get them, and then that's the link there. You can get our stores.
Your sound quality's gone off a little bit in the People First office. Faintly. Are you behind the screen? Your microphone's perhaps not picking up very well.
Okay.
Let us know if you can.
That's better.
Okay.
Yes, if you start from
Yeah, yeah.
If we
Okay.
just go on the left slide,
Okay.
please, Kat.
The last one,
Yeah.
Yes, please.
this one.
Yeah.
Okay. How can the palliative of care community support people with learning disabilities? Speak to us in an open and honest way around pa- sensitive conversations around palliative care. We can deal with it. We may need information about palliative care in easy read if you want to help you on this. Get in touch, speak to us about our choices for end of life care. We have a voice. Listen to us. Thank you. Thank you. Okay.
So thank you very much, guys. That was a lovely talk. Paul, you wanted to say something about your mum's care, I think, did you?
I did, yeah. As I say, so did a bit like I do miss my mum a lot. My mum passed away with cancer. I took a year out of people first to look after my mum.
Mm.
Carer, and my dad thanked me very much. He said to me, "Thanks very much for looking after your mum." No, I used to take my mum up to the Marion Square in a wheelchair shopping and took her for a day trip into town and memories of that.
I'm
Going,
sure she loved that as well. I'm sure she loved spending time with you.
yeah, I used to like my mum a lot. My
Yeah.
mum used to say, "Oh, my mate taught me."
Yeah.
Um,
Yeah, I think
really,
we're all very
just
close to our mums.
yeah. My mum's looking down on me now. Everything I'm doing in people's face, my mum would be proud of me.
Oh,
And what
absolutely.
I'm doing, I've been a director as a company,
Yeah,
so I'm built up at myself, proud of myself.
that's lovely. So I do have one last slide on that slide set actually that I'll just share. So we'd seen your web link on one of the other slides you'd put on there, but some of the other stuff that's on your website include some films that I think are very informative. Some easy read booklets. That's right, isn't it? That you've developed. And
Yeah.
then the other resources that I was talking about, the Victorian Stuart Project, I've put a couple of links here and we'll share these slides with the people who are on the call afterwards as well as the recording. But I think it's important to say that all these resources, especially the people first resources, you've helped to develop. So it's all about the key messages that you were talking about in the last slide were about talking to you, about being open and honest, about the easy read information, about keeping in touch and actually hearing your voice and hearing you say what you want. Is this Rebecca?
Yeah.
Hello, Rebecca. Nice to see you.
Sorry, I was just as with thought on my organ donation card, I misplaced it.
That's fine. So, Rebecca, did you have any? Because we've just talked about the slides, and Paul's talked about his mum's care. Was there anything that you particularly wanted to say today that you thought you'd bring to this?
Yeah, sort of got my nanny,
Yeah.
John Macmillan coming and to look after her. She died in hospital and we went to her funeral.
Hmm.
She died of breast cancer.
Yeah.
So-
I'm sorry.
yeah.
Yeah. And so do you share the same views as Paul and Nicola that you just want to be talked to about things and to be open and honest?
Yeah, to be open and honest, yeah.
Absolutely. That's lovely. Is there anything else that you wanted to share today?
I said about the coffee morning.
Yeah.
How we held the Macmillan coffee morning in a people face.
Okay. And when's that?
We organised one. I see an advertisement on. I think we held our first one. I see an advertisement on Facebook about the Macmillan coffee morning because held one and raise money for Macmillan.
Absolutely. And
did.
it's a great
And we
cause.
did, yeah.
Wonderful. Does anybody, so we've got quite a lot of people here today. We've got 74 people on this call, so that's a lot of people. Does anybody have any questions for any of the people first, guys? I don't see anything in the chat apart from a couple of people saying they're great presentations. You spoke really well and thank you for the information. So that's good. Any hands up? Any see Jane and Dave, you can be my eyes and if you see any hands going up. Heather. Welcome, Heather.
Hello, hang on. I'm just going to put my camera on if I can. Let's get that on. Okay, hi.
Hello.
Hi. Hello. Thank you for that presentation. That was excellent. Often at the hospice, so I work at work in a hospice in Lancashire. Often we find that if we have patients with learning difficulties or we have relatives, their mums or dads or grandparents, we often find that the family are trying to protect the person with a learning disability. So we will have maybe an aunt or an uncle saying, don't tell them, we don't want you to, and it can be quite difficult. So it's just, what would you say about that? I know you're saying quite clearly you want to be spoken to, but what do you think if there's a relative there saying, no, we don't want you to talk to them, we think it's better if they don't know all of this?
I don't think it's fair they say not to talk to them because it'll upset them that say if the person passed away in hospice and they're not told.
Yeah.
It's better if they were included in the conversation rather than being left out.
Yeah.
And it'll help come to terms that lost the person and come to their funeral. It's only right saying that you should be included as come to the funeral
Yes.
rather than being stopped from going.
Yeah, no, I agree with you. Thank you.
You're welcome.
Thanks, Heather. That's a great question. And somebody in the chat said, be a very good question. They get that happening a lot in the hospital and it can be very difficult. So I think maybe the families think that they're doing it best by protecting their relatives, whereas what we're hearing is that they actually want those open conversations and those honest conversations. So something to bear in mind. People saying thank you for the presentation, it was really good, and the resources look like a great tool. So I'd encourage you to go and have a look on those websites, the People First website, all about the David Project, and the Victoria and Stuart resources as well. There's lots of stuff on there, so it's well worth having a good look and watch some of those videos. So I think if there are no other questions for People First, and I hope you're going to stay with us, People First. Are you going to stay with us, Paul and Nicola and Rebecca? stay with us
Yeah.
for a bit longer in case there are any other questions coming up. So would I move on to Carl now, I think, if that's okay. Carl, I hope you're with us. So
Catherine,
hiya, Carl. So Carl Jones is the clinical lead with Knowsley Community Learning Disability Team, and you're going to talk about the Advanced Care Plan Easy Read document that had been developed in your locality, and give us a bit of background on that. Is that okay?
yeah, absolutely. I've got a
Perfect.
brief presentation which I can figure
Brilliant.
out how to share. Hang on one sec. So I absolutely will not take any credit for this work. It was completed by a couple of people who were within our team, and I'll kind of go through who they are at the minute. We've also got Debbie on with us as well, who took a leading role in kind of developing this stuff. So this was just something which was developed within our trust, which is advanced care planning in an easy read format, because there were some other kind of formats before which we'll show you, but it's we realised that it wasn't really fit for purpose. So I've got myself, who's the clinical lead for the Knowsley Community Learning Disability Team, and Debbie, do you want to introduce yourself? I don't know whether Debbie's still...
Debbie's
Sorry,
here,
that's
but
it.
she's
Yeah,
on.
you
She
go.
was on mute. There you go.
Yeah, I'm there. I'm the speech and language therapy assistant, so I work with Carl. So.
Excellent. Okay, so within the trust, we do have kind of end of life services as well, who will do advanced care planning. They look at using the Mental Capacity Act to assess a person's ability to make decisions for the future. And if a person lacks capacity, then they can complete a plan within best interests as well, with people who know them really well, but still involve that person throughout that process. And they'll also take into account if somebody's got a lasting power of attorney or deputyship over somebody's health and welfare. So the specialist palliative care teams who provide education about advanced care planning to all of our staff. They've collected data on place of care for and place of death to submit to commissioning boards and the government. So this is kind of what's kind of led up to some of the pieces of work that's being done. They measure themselves. We met as a trust. We measured ourselves in line with the ambitions and NICE guidance, and we updated care plans in line with the national guidance as well. So the previous care plans that they used to have were really long-winded. They lacked visuals. It was 12 pages long, and the first 6 pages explain about the wishes and preferences. And then there's a page on LPA, and it was just felt like actually this just wasn't an accessible document for people to use. This was another one of the previous easy reads ones that have been put through, but what we'd kind of realised is we're aware of their health inequalities for people with learning disabilities, and that can absolutely extend into palliative and end-of-life care. Leader reports were telling us that people with a learning disability often didn't get a chance to plan what will happen at their end of their life. And people with learning disabilities are often protected from conversations about death and dying, and this limits their opportunities to think, plan, and grieve. So the work started as we've got 2 end-of-life champions. One is Debbie Alvers, who's just introduced herself, and we've got a health facilitator, Karen Turner, and they attended the end of life meeting for the trust. In one of the meetings, the team discussed advanced care planning and identified the gap for the accessibility for people with learning disabilities and the opportunity for people to engage in those discussions. And Debbie and Karen, along with the advanced care planning team, decided to look at developing an easier read version. Debbie, I'm happy to run through this unless you want to kind of run through some of the work that you had done, because obviously I don't want to take any credit for the fabulous work you guys have done there.
No, that's fine, Carl. I can always jump in. You're doing a grand job.
Okay, thanks. So Karen and Debbie had took their ideas to the Learning Disability Health Forum self-advocacy group within the LD Partnership Board, who helped think about what needed to be included and how it would look. They also went to some ask, listen, do groups within the trust, and that we were told that they preferred the photo symbols. So this is we were using it for the people within our area. So a decision was made that we needed to recomplete all the symbols and kind of tighten it down into an easier read format as well. And the advanced care planning team and other professionals also helped to develop the easy read to ensure that it included the important bits of it. Was this the one? Sorry, I've got a better version of it, which I can show. So other things that are being done. So the advanced care planning team, I'll share the actual easy read advanced care plan on a bit of the bigger format in a moment. But what had been done from there is the advanced care planning team include the easy read advanced care plan and mental capacity within their training. Health facilitators in Merseycare include this in the GP awareness training as well. They developed the easy read version of the Citizens End of Life Charter. They've consulted ask, listen, do groups about the development of bereavement cards as well. Staff from the Learning Disability Services attended end of life training, and that's been kind of revisited again recently. And we've looked within Learning Disability Service at what the bereavement offer is, and work has started to standardise this offer as well across the learning disability teams in the trust. We included end of life and advanced care planning discussions within the initial assessment from a community LD team. So we ensure that we ensure that as part of that, we ask if anybody does have any, but if this is something that people want to start thinking about in discussion and get some of their wants and needs down earlier on. So the Merseycare Trust end of life strategies align with the palliative care ambitions document, and in our work streams or patient experience, communication and understanding my care plan has been a theme as to what we've done. So because they really wanted to co-produce these documents with the people who access our service. So hang on one sec. I will share the, let me just stop sharing there. I will share the document. Sorry, I was just mindful of everybody's time, so I have kind of flown through that presentation there.
We've got plenty of time, Carl. So
oh, have we?
Yeah, plenty.
Just while I'm getting this up, Deb, I don't know whether there's anything else that you wanted to kind of add in, which I've missed out on some of the work, which.
I don't think so, Carl. You've covered like all of it. We had a lot of consultation with like different groups, like you said, and we took into consideration their feedbacks, and so I think everything we more or less addressed, and at each stage we went through and got clarification from the different groups that we attended.
Okay. Thanks, Deb. So this is the document which was developed. Can everybody see that? Yeah, I'm struggling.
Yeah, we can see that.
Excellent. Okay. So the first stuff is kind of just people's demographics, so they've all got that there. And then important to try and what's important to somebody in the here and now, and these are stuff which would probably continue to be important to somebody if they developed a life-limiting illness. So what I would like people to know about my preferences and wishes, and we've put in terms of conversations cards can be introduced here. There were some easy read conversation cards developed, weren't they, Deb? I couldn't find any in my files, but there was some easy read conversation cards which would help people think about what they want towards the end of their life as well. What concerns I might have to my future. So what are my worries? What medical treatment I would like, wouldn't like. And then where I would like to receive my care. So we've really kind of cut down, we've really tried to kind of cut this down into as little of a document as we could, and make sure that it was put this out in an easy read format. And then there's just some things around if somebody's got lasting power of attorney for health, and if they've got advanced decisions to refuse treatment. So I'm happy for people to ask questions now.
I don't see any questions in the chat. I see a lot of comments about thank you for sharing the resources and the presentations. People have enjoyed them. We have got Dave's got his hand up, so I've got a question from Dave.
Thanks, Kath, and thanks for the presentation, Carl. I suppose I'd be interested to know what feedback you've had since launching the document and using it, and how either patients feeding back or other professionals feeding back. Is it a useful tool that you're now using?
So in terms of actual direct, we've not really had much in terms of any current feedback from what ones where they have been developed. We've actually only completed some with a few people within kind of our direct service. We've also shared it with our local hospices as well, so they've got access to them and can do them with any individuals who are coming through. But I've not had any kind of direct feedback from any patients as of yet, but we have found it was a useful tool with a couple of our patients, because it just broke things down, and also in doing this, it's helped kind of our practitioners open up those conversations a little bit easier around, okay, this is, you know, you've having control over your choices is really important in the here and now, and it would be important, you know, if you were to become really ill, or if you were to have a life-limiting illness. So shall we get some of these things that are important to you down, and just having that as a little bit of an easier read prompt, as we've found kind of useful in even just starting some of these conversations with people as well.
Lovely, thank you for sharing, Carl. So we'd asked Carl and his team along today because we think that locally that's the only example of an easy read advanced care plan document that we know of. But when we were talking about resources earlier, I don't just want to share my screen again, if that's okay, just to show you a couple of the websites that we were talking about. So this is the People First Merseyside website, and we're on the resources section, and these are some of the booklets that they've developed. Rebecca, Nicola and Paula, I expect you'll recognise some of these. They were in your presentation, and you can download them, and they are free resources. So there is lots of stuff on there, as well as some useful videos and some things that are not particularly related to palliative care, but could also become useful for you in your practice. So lots of stuff on there. And then the other resource that I was talking about, the Victorian Stuart Project, and they have this toolkit, and there are lots of resources in there. In particular, cards. I think, Carl, you mentioned some cards. So they also have my funeral cards and when I'm ill cards, which you can order. And I think they're also free to get off their website. So another useful resource, I think. So I'll stop sharing that. Were there any other questions for any of our speakers today? We've got one in the chat. Carl, do you feel this will sit alongside the health passport and when people come into hospital? That's from Serena.
Yeah. So if people have got them and they're wanting those shared with the hospitals, because it could be shared with the GPs, and it can be shared with any health professionals that they're wanting, but it is probably one that could come into hospital, especially if that's where they're wanting their care and support, particularly if they are quite unwell. But yeah, we'd be, as long as the patient was happy with it, we'd be happy to share that document with yourselves, and could be uploaded alongside the health passport.
Brilliant, thanks, Carl. That would have been a question from me. Is are you happy to share your document and people can have a look and maybe use it or adapt it for themselves? Jane, you've got your hand up. Do you have a question?
Yeah, so great presentations from everybody. Carl, I was just wondering, when have you been introducing this? So has it been when somebody's possibly had a hospital admission for a chest infection, for example, or if they've been through some investigations, or has it been something quite proactive that you've decided to introduce as you've made contact with that person?
So we ask the questions part of our holistic assessment, our initial holistic assessment, if anybody's got, if they've got an advanced care plan, and if that's anything that they've considered, and if they want to know more about advanced care plan, and we can discuss it with them at that point. A lot of the times people are mostly engaging with it if they've had been diagnosed with a life-limiting illness. But I think there's still work to be done, I think, across the board around practitioner confidence in opening those discussions with people, because there still is a lot of discomfort around it, isn't it? With anybody really, and not just with people with learning disabilities, but yeah, we are asking about it as that initial contact with our service.
Yeah, and I suppose another question would be if it was the hospital team, for example, that were wanting to have this conversation with a person who had a learning disability and they were unsure how to start that conversation, they could reach out to learning disability teams for some advice and support about how to have that conversation. Would I be right in thinking that?
Yeah. We have had people who've been referred through just to support around some of those discussions, but we wouldn't necessarily be holding a conversation to say you've got this life-limiting illness, because sometimes we get referrals through to tell people that, and it's like, actually no, we don't. We're not best placed, because we won't have as much information to share as you guys would, but also it needs to be, people who've been doing those investigations, or people who they know and trust to hold some of these. But yeah, we have accepted referrals through for to support the advanced care planning process as well.
Great stuff. Thank you.
Thank
Thanks,
you.
Kath.
So I can see 2 hands up and a question in the chat. So I think we'll go to first hand. Andrew, welcome. Have you got a question?
Yes, thank you. Andrew Kodabakis, Consultative Palliative Medicine in Southport, West Lancs and Formby. I'm here with our team here as well. I think we talked about some of the blocks of having these open conversations and reflecting on a really significant case we had last year. I think, as well as kind of well-intended family members and health professionals, and there's also the support workers that often lack having that guidance and that support and that training, because they're either employed by other care agencies or other charities as well. So I was just curious for both People's First and also from the team at Mercy Care. How has that engagement gone in terms of trying to get everyone that helps support people to delve into this area?
Right, so people first in the room there, the Nicola, Paul and Rebecca, you've had your hand up for a while, so do you want something to say there? You're still on mute, so if you, yeah, that's great.
Carl, where would we be able to find this form?
I can share it with you, Paul, from People's First. I'll send it over to Catherine, and she would you be able to share?
I'll share it with you. That's absolutely great. Once, yeah. In terms of Andrew's question, Carl, have you got some insight?
Yeah, so I mean, we've mostly done so. Our practitioners would be advocating for to these people, and we told some of those discussions around actually, although it's this is a really upsetting topic. Could be a life-limiting illness. It could be a family member having a life-limiting illness. But the impact of not knowing and finding out late is much worse for some people. Equally, we have had a case which we've shared where actually the individual who we were supporting, who had a learning disability and she was autistic, she didn't want to have any discussions with her about her end of life, about her prognosis, and we had to kind of do advanced care planning in a bit of a roundabout way with her to try and find out what was important for her, so that we could keep that as important. And we managed to get little things around funeral planning, but if you touched on anything regarding prognosis, she'd become really anxious. She'd shut that conversation down, and she wouldn't want those discussions at all. And we've respected that because that was the individual's wish. But yeah, we tend to just hold some quite open conversations with the care provider and with family members around actually the impact of not holding these discussions can be really distressing, because actually a lot of people will be very, very, very aware that something's not right, will be very, very aware that something's going on in terms of their own health, and to not be able to either have any reassurance or like a full awareness of what's actually going on can be really, really anxiety provoking. So we tend to just advocate around that when we're going out and we're having some of these conversations with families.
Thanks, Carl. So Chris's comment in the chat, it's more of a reflection maybe than a question, that she thinks they don't have many people with learning disabilities referred to hospice services, and wonders, is it the same for others, and whether anyone's got any insight as to why that might be. So if anyone's got a reflection on that, you could please come in. But in the meantime, I'll go to Lisa, who's had a hand up for a while. You're on mute, Lisa, I think. Well, we can't hear you anyway. I think you're off mute, but we can't hear you.
Right.
Yeah, that's better. Can hear you now. No, you've gone back on mute.
Can you hear me now?
Yes, absolutely. Okay. Brilliant. Go, fire away.
As you can see, I'm a technophobe. I wanted to respond to Andrew. I worked in Derbyshire in a day hospice, and we had a lady that had learning difficulties, and she was also deaf. So that was quite a compromised position for her, but she wanted her family to know that she wanted to make decisions. So we called a big MDT, so we had everybody there, learning disability nurses, the district nurses, the GP, all the health professionals that were part of her team looking after her. And the family were quite against her actually attending the meeting. And we said, well, it's about her, and she wants to express what she wants from end of life care. She understands that she's dying, but they were frightened in case they made her more upset. Also, we had to support, because she lived in a house with other people with learning disabilities, we also had to support them. So they came into the hospice and they were able to talk to our daycare services and, you know, say, oh, the patient was feeling unwell. Why is she, you know, acting in this way? Why is she feeling sick all the time? Why is she tired all the time? And we were able to explain those things to them with her consent. Everything was done through her and through her consent because she did have capacity. Then the carers that were looking after these people in the little home, there were only 4 of them in the home, wanted some advice on how to look after the patients. So we did some teaching sessions for them. And taught them about end-of-life care, taught them what they would need to be able to facilitate for her, talked about symptom management with them, told them who they could call upon, you know, at the end of life. And it worked really, really well because everybody was involved and everybody knew what everybody else was doing. And God love her. She had the best death. She had her friends with her while she was passing. She had her family with her. She had her carers that all loved her. And she had a good death. She actually had a birthday celebration before she died. She had a big party and she invited everybody that had looked after her and all her friends. So, you know, we feel we facilitated a good death for that lady, and her family came back and said thank you. And I think that's all you can ask for, is that the family are glad that you've helped them, supported them, and they've done the right thing for their relative. But it's getting the multidisciplinary team together and the family and the person that it's all, you know, involves. That's the most important thing.
You've got a good reaction there from the People First office. And what a lovely story. There you go. And what a lovely story. Thank you for sharing that. And yeah, it just go to show that once everybody's on the same page and everybody understands and everybody's allowed to input, that it makes the experience so much better and richer and the lasting memory of that. So a couple of people have shared reports in the chat, so that they'd probably be useful to have a look. Chris, I don't know if that addresses your question. Hopefully it does.
Really useful, thanks.
Great.
I just wanted to reflect on that as well. So a lot of our people we support who might end up with life-limited illnesses, where we've done any kind of advanced care plan or advanced care plan discussions, I've already got quite a lot of support at home, and by people who know them and they're comfortable within that home environment, and so, and they might have some extra support from DNs or community matrons going out to provide that care at home. So that might be why, because there's already this high level of support we're going into the homes, that might be a reason why less people are referred through to hospices in some cases. But also, I think, you know, as much as there's been a lot of brilliant work around avoidable deaths, and that's what the leader program's about, and learning from the lives and deaths of people with learning disabilities. I think there's still a long way to go. So actually, I think sometimes people are dying from unexpected death, and that time for planning and ongoing support is maybe less so than the wider public. The opportunities for that is less so than the wider public.
Thank you, Carl. Don't see any other hands up, and I don't see any other questions in the chat. I'll just go back to Paul and Rebecca and Nicola. So you were saying that this is the first time you've done anything like this, and you've done something on the screen. Has it been a good experience for you? I think their screen might be frozen, you know. I'm just looking at it now. I think their screen might be frozen. I hope you can hear me. We just wanted to say thank you so much for presenting to us today and for taking some time out of your day, because I think people have found it really, really helpful. A big thank you to Carl and team for your presentation and for agreeing to share those resources. I hope you get a chance to look at the resources that we shared today, and I will send the links to you. I'll pop them in the chat so people can access them later. If nobody else has any comments or questions or anything to share, I think what we could perhaps do now is give you all 8 minutes of your time back. We were going to stay till 2, but I think we can all go and get a drink.
Thank you very much.
Thank you everyone for coming.
Thank you.
Thank you.
Thank you.
Thank you.
So, you Wi-Fi problems there?
Yeah.